Okay, so my patient is a 58-year-old male with throat cancer. I have orders to suction and clean his trach. I'm going to put my PPE on. I'm going to enter the room and introduce myself. Wash my hands. So first I'm going to do all my safety checks. So I'm going to check his suction, his oxygen, his vitals, 2 identifiers, and make sure that I have a spare trach. Just in case it ever got pulled out, it's good to have that at the bedside. I'm going to need an ambu bag, which is used for hyperoxygenating. I'm going to take off the Christmas tree on the oxygen and switch to the ambu bag and crank that up to 100%, and then flip it to 15 liters if I was to do hyperoxygenation, especially if the patient's unconscious. I would put it over his trach and squeeze twice the ambu bag, and then I would check his O2 stats again. Then I would switch it back to the regular oxygen. They also may need humidification if they're on long-term trach care, so that's also something that might need to be at the bedside. And I would need extra trach ties and a dilator, which is used to dilate the stoma, especially if it's a new stoma. Okay, so I've checked for safety, and now we're ready to suction. So I will explain to the patient what I'm doing, elevate to semifoulers. I'm going to attach 1 tubing to the vacuum port and then 1 tubing to the patient. I'm going to attach my suction catheter, and then I can just leave that hanging there, or you can put a glove around it. I'm going to check his O2 and hyperoxygenate with the ambu bag if he's unconscious, or have them take 3 deep breaths with the O2 increased to 100% if they are awake and able to do that. And then check his oxygen. So I'm going to get my supplies ready. I'm going to get my sterile trach kit. The trach mask is still on, and so he's still getting his O2 at 2 liters there. Okay, so here he is. I'm not sure. Yep, you can see that pretty well. I'm going to take off his mask and open the saline. So this is my saline before putting on my sterile gloves. I'm going to turn on the suction at the correct rate, which that is at 80 millimeters of mercury. I'm going to put on my sterile gloves. So here is my field, making sure to only touch like 1 inch around at the most. Okay. Okay, so that one is now sterile. I'm going to lose my left hand right away because I'm going to take this glove out. Put this one on. Making sure not to touch my hand with the sterile glove. So now we have a sterile field here. So now I can take out my catheter. And then I'm going to keep this in my right hand. So that is going to be the hand that I keep sterile. Okay, so now I'm going to take the suction, the catheter connected to suction, and I'm going to attach that to this end right here using sterile technique. I'm going to lose my left hand because I'm going to hold onto this regulator with that hand. So I've connected my catheter to the suction at 80 millimeters of mercury. My non-sterile hand is on the regulator. I'm going to take this end of the catheter. I'm going to lube it up with my sterile saline. So I'm going to place that in there. And also I'm going to double check that the suction is working. I'm going to have my thumb off of the regulator. And then, oops, I apologize, this is not correct. This should have been off already. So I should have done that before I had put that glove on. Okay, so now I'm ready to go in and suction. So once I go in, I am going to go in about 5 or 6 inches. If I feel any resistance, I'm going to pull out about a 1/2 inch to 1 inch. And then I'm going to be doing intermittent suctioning and twisting at the same time. So I'm going to go in about 5 inches. Okay, and then I felt that resistance. I'm going to pull back a little. And now I'm going to intermittent suction with my thumb. I'm going to twist. Twist, twist, twist. And I'm doing this for a max of 10 to 15 seconds. Okay, so now I've taken that out. I'm going to clean that with the sterile saline. And then if I was to do a second pass, I would need to get a whole new catheter because this is now not sterile. And then I would place this back on. And I would check for my ABCs to make sure the patient was doing well. Okay, so he's doing great. So this is either happening at the same time or at another time. I'm going to clean up my supplies, wash my hands, and then I'm going to come back in and I'm going to do my cleaning of the trach. So I'm going to put all my items away. Okay, so now I'm going to be doing the cleaning of the trach. So I'm going to wash my hands. I'm going to grab my tracheostomy cleaning kit. I'm going to open this up. Okay, I'm going to grab my, just touching the very outer corners, grab my gloves. Okay. I'm going to put on just one glove, so I'm going to make sure keep that sterile while putting that glove on. Okay, with my unsterile hand, I'm going to just taking the Axel, can you go turn that water off? Okay, shiny side up. I'm going to drape my patient with this. Place on the patient. I'm going to take off the mask with my non-sterile hand. I'm going to pour the saline into my tub here. Okay, so now I'm ready to put my other sterile glove on. So I'm going to do that without touching my hand. Only the outside there. Okay, so now I'm sterile, both hands. Next thing I'm going to do is I'm going to take a couple of these Q-tips and I'm going to place them in the sterile, the saline. Those are going to be used for cleaning. Take my pipe, or this cleaner, I'm going to place that in there. I might place one of these gauzes in there too. Okay, so now I have my sterile field, I have my items soaking, and I am ready to get started cleaning. So I've already taken off his mask. My sterile gloves are on. I'm going to remove the inner cannula, turning it to the left to unscrew. Okay, so I've done that. Sorry. Okay, unscrew. So that's with my left hand. So now this one. So I'm going to place that in my saline solution. I'm going to take this cleaner brush here and I'm going to clean the inside, I'm going to clean the outside, I'm going to clean through the middle. Okay, just getting all that gunk off there. And then I'm going to take my pipe cleaners and I'm going to clean, or I'm going to dry off, that with the pipe cleaner. So I'm going to make sure it's nice and dry. Okay, if I need to use the other one, I can do that. Nice and dry. Okay. And now I will screw it back on. So screw to the right until I feel a lock. Okay, so that's done. So now I need to clean around. So what I'm gonna do is I'm gonna take my Q-tips that have been soaking in the saline, and I'm gonna clean underneath, starting from the stoma and then working my way out, Oops, I apologize. Originally, before I put my gloves on, I should have taken off this fenestrated dressing right here. So that should have happened in the very beginning steps. Okay, so now I'm cleaning stoma out. My next Q-tip, oops, stoma out. I'm gonna take my wet gauze and I'm gonna clean it, especially if there's like a lot of gunk on there. So I'm gonna clean up and around the whole plate, all around the whole area. And then I'm going to take my dry gauze dressing and I'm gonna dry everything. Make sure everything's nice and nice dry, okay? So everything is dry. Sorry, this thing is coming off somehow. Okay, so that's been done. I'm next going to take my clean fenestrated dressing and I'm going to place that up and around. Okay, so I already have ties on, so I want to replace those ties. So I'm going to take these new ties and I'm going to wrap them around and tie my square knots, and then I'm going to remove the old ties. So it's important to put it on first just to make sure that this is nice and secure before you remove the old ties. Okay, and then I'm going to assess my patient. I'm going to assess the ABCs. I'm going to clean my area, wash my hands, and document what I've done and then how the patient responded.